Hello, I'm Dr. Scott Kelly, your cataract specialist here at Howerton Eye Clinic. You are watching this video because you or your loved one has a cataract and is considering cataract surgery. Surgery to remove cataracts is one of the most frequent, safest, and successful procedures performed in medicine today. A cataract is a clouding of the normally clear lens inside the eye, which prevents light from focusing properly on the retina. As cataracts develop over time, one's vision becomes blurry and foggy, making it difficult to read and drive, especially at night. Once a cataract develops, the only way to achieve clear vision again is to surgically remove the cloudy cataract and replace it with an artificial intraocular lens, commonly referred to as an IOL. We have a variety of IOL options that we offer our patients. The lens that is right for you will depend on the health of your eye and your occupational and lifestyle needs. It is important that you consider your options thoroughly, as you only have cataract surgery one time in your life. And the decision about which IOL you want will affect how you see for the rest of your life. The basic lens is a monofocal IOL that can provide only one point of clear vision, which we usually set for distance vision. If you choose the basic monofocal IOL, you will still need glasses for near and intermediate vision. This standard monofocal IOL is covered by most insurance. However, many but not all patients also have astigmatism. Astigmatism is caused by the cornea, or outer window of the eye, being shaped more like a football than a basketball. This causes images to focus at different points on the retina, resulting in blurry or double vision. Patients that elect to have the basic monofocal IOL, but not have their astigmatism treated, will need to wear glasses for clear vision at all distances. If you have astigmatism and are only interested in good distance vision without glasses, you can upgrade to a monofocal toric IOL that will treat your astigmatism and correct for distance vision. For patients who would like to reduce or eliminate their need for glasses at all distances, near, intermediate, and distance, we offer several types of advanced IOLs that can provide this full range of vision and correct astigmatism. None of these IOLs are perfect, but they can free you from dependence on glasses about 90% of the time. The most common feedback I hear is that some patients say they may still use reading glasses when the lighting is dim, or that they need to read something very, very small. For instance, reading in bed with low light or seeing a menu with small print in a dark restaurant. The other feedback I hear is that initially some patients say they see halos and glare around lights at night. What I don't hear is patients saying they cannot drive because of these visual side effects. They'll say their vision is much better and they really like having good distance and better close vision, even though they have some of these nighttime side effects. The good news is that over time, these rings and halos will become less noticeable, and many patients say they no longer see them at all, as the brain automatically works to minimize these visual side effects through a process called neuroadaptation. Only you can decide which type of IOL is best for you. Are you happy with glasses? Or do you want to be free of glasses about 90% of the time? It is totally your decision. But again, this decision will affect how you see for the rest of your life. There are additional costs for the astigmatism correcting IOLs and the advanced IOLs that provide a more full range of vision. Your insurance will cover the cost of the surgery itself with whatever IOL you choose, but you will be responsible for additional costs associated with the type of IOL you choose. Now, let's talk about the cataract procedure itself. We only do one eye at a time, with the second eye procedure about 1 to 2 weeks later. Someone will need to drive you to and from surgery and back to the office the following morning so we can make sure everything is healing correctly. The procedure itself takes about 10 to 15 minutes, although you will usually be here for a couple of hours, and then you can go home and relax for the rest of the day. Most patients see a noticeable improvement in their vision by the very next day. You will start taking eye drops 2 days before your procedure and continue taking them for a month after surgery. We will give you a calendar to help guide you on how and when to use them. During the surgery itself, we use very powerful eye drop anesthetic medications, and we will administer an IV with medications that will help you relax. Most people say it is completely painless and sleep throughout the entire procedure. We will give you additional information about cataracts and the IOL options we offer to take home with you. If you have any questions after watching this video, please do not hesitate to ask me or any of my staff. Thank you.